Humanistic care is important to me as a future family doc because I want to know the upbringings of my patients, their backgrounds, their values, what they hold most dear to them. And I think knowing these things and meeting them where they're at provides a very special touch point, a very special connection to lay the foundation for a rich and vibrant and fruitful physician-patient relationship.
Humanistic care has really become a core value of mine in my everyday life, and it's very important to me as a future physician. Studying from textbooks, doing questions, and interacting with standardized patients, it really makes it easy to be robotic with patient interaction. However, quality care is delivered with that humanistic approach, being able to customize your interaction with the patient in front of you, and making that patient feel like they are your only patient by listening to them and comforting them.
Humanistic care is important to me because all of us and our family members will require medical care at some point. I want to provide care that I would want for my family members. Care that is free from bias and discrimination. Care where my patients feel like they can trust me because they know that they are truly cared for.
Humanistic care is so important to me because I think the ability to put patients at the center of what you do every day for the rest of your life is something that is offered only to the profession of medicine. It's something that's so unique to what we as physicians do. And I think that it's such a privilege, right? These patients put their lives and their livelihood and their health into our hands, trusting us with it. And I think in return, we owe them the best care that we can offer.
I believe humanistic care is important for every single patient experience that we encounter because it's important to be humble, patient, and keep in mind the values that are so important to our patients. Every patient is unique, every patient is different, and they have a lived experience and a story that will, in part, create overall their experience or will add to their health in some capacity.
Every decision we make as doctors should be based on our patients in mind, and we should do our best to not just know their conditions and their vitals and their labs, but who they are as people, what they want. And by getting to know our patients, we can best address their physical, their mental, their social, but also their spiritual needs. And that's the way we can best provide humanistic care for our patients.
Humanistic care is very important in medicine because beyond challenges with a patient's health or physical concerns, they're also going through emotional challenges. As physicians, it's our job to look at every part of their care, including these emotional challenges, and being able to be active listeners to their stories.
Humanism closely aligns with the tenets of osteopathic medicine. Embracing the whole person, suspending your judgment, understanding your patient's perspective, and listening carefully to those for whom you care.
An advice I would give future medical students in regards to humanism is that an important value necessary to build a strong patient-to-physician relationship is to be a great listener and to be patient with your patient.
For new medical students who want to keep compassionate and humanistic practice at the center of their medical education, I would recommend listening deeply to your patients. Remove any distractions that may serve as a barrier between you and the person in front of you. Take the time to clarify what your patient needs. Ask questions. Give your patient a platform to speak and allow them to feel comfortable doing so.
Take opportunities to volunteer in the community, helping those who are underserved, and pretending that when you have a patient in front of you that they are your immediate family member and that they are your friend. That will allow you to help them the most, because to truly care for someone and to truly care for a fellow human being that you don't even know is something you need to develop as a physician. It's essential.
Read books and essays. Some great examples of books I'm talking about would be When Breath Becomes Air, How Doctors Think, Becoming a Doctor, and Slow Medicine. And our school also does a wonderful job of assigning essays that help to remind us that we're treating a person and not just a disease. And I would also add that we need to remember that our patients are human beings that have loved ones, dreams, and ambitions, regardless of how they appear when we meet them.
To any incoming medical student, I would say definitely study the cold, hard science of medicine. It's important. Exam grades are important. Board scores are important. However, at the end of the day, the patient is not going to remember whether or not you knew what interleukin 3 was, or whether or not you scored above a 260 on step 2. They will remember, however, how you made them feel at bedside, right? They will remember how you made them feel. They'll remember how you were. They'll remember what words of comfort you were able to offer them. And I think that all comes from having a humanistic touch. So the cold, hard science of medicine is not something to be easily counted out. But if you don't have a humanistic touch, I think all of that can be for naught.
My advice for a new medical student is to be intentional with including things in your life that you're passionate about besides medicine. There's always going to be more things to study, more research articles to read, more Anki cards to do, but you're not always going to get the time that you have now. And you might feel guilty for it, for pulling away from your studies, but it is essential to schedule in time during the week to do things that nourish you. And whatever that looks like, it's important to do it because we are also humans. And to be good doctors, we need to be good humans first.
I really advise you all to try and employ this humanistic care in your everyday life, and not just in the hospital setting. Whether that's listening to a classmate who is stressed, or helping an elderly patient get groceries from their car into their house. The intuition to know how to help and when a patient needs help without them explicitly asking you is a valuable skill that can be developed.
A patient I remember vividly was in a chronic pain clinic, and after getting to know the patient, he sat down and just started crying because he said that every other clinic he's ever been to, they kind of just rushed him out the door. They didn't listen to his problems, and they assumed him of being drug seeking when he wasn't. He was just in a lot of chronic pain. He had a lot of trauma in his life and just wanted someone to listen to him. So I was able to talk to him about his problems and give appropriate guidance and options for treatment. And most importantly, I got to discuss his goals of care, and I got to lift his spirits up a little bit, get more confidence that the doctors caring for him care about him and want him to get better.
There was a patient who came in as a fall patient during my internal medicine clerkship, and she was saying that she just fell in her living room. One point she was standing up, and then the next second she was on the floor, and she was saying that she didn't know what happened. But I was spending a lot of time with her each day, just learning more about her life, outside of her current condition, to the point that she felt comfortable sharing the truth of what actually happened during this event that caused her to fall. And she shared with me that she was actually getting abused by her husband. And uncovering this fact was very important in changing the future trajectory of her stay at the hospital. And I feel like I made a significant impact on that patient, and that just goes to show how important, especially as medical students, how important it is to listen to our patient stories and to be humanistic.
I always close my patient visits by asking if I can get you anything. A few years ago, I was taking care of a woman who had been diagnosed with metastatic breast cancer. She had decided to forego any further chemotherapy or radiation treatments and instead pursue palliative measures. During one of our visits, I asked my closing question, and her response was that she wanted a steamed lobster tail with butter. After I finished rounding for the day, I went to a local supermarket, ordered a steamed lobster with butter, and brought it back to her. This turned out to be her last meal. The nurse taking care of her told me that she had passed away the next morning, and that her last words were, "Please thank Dr. Powell for me. This will stay with me the rest of my life." Medicine is a profession that requires both the head and the heart. The head for clinical skills and knowledge, and the heart for caring.